Hi, my name is Thomas May. I am the Floyd and Judy Rogers Endowed Professor in the Elson S. Floyd College of Medicine here at Washington State University. While there's a concern that vaccines were approved under an emergency use exemption rather than full FDA approval, the number of iterations of vaccine administration is very high. It normally takes many years or even decades to have the sheer number of data points we already have for our COVID-19 vaccines. This makes the likelihood of unrecognized short-term side effects very small. As far as long-term effects are concerned, this will simply require the passage of time. These types of side effects are traditionally very rare for vaccines, but will have a larger effect on our estimation of how long the vaccines remain effective for. Will the vaccines be effective for 6 months, for 1 year, for 2 years, or 10 years? We will only know this when that much time has passed. However, I think many of us saw newspaper stories claiming that effectiveness was only for 6 months. It's important to remember that scientists limited their conclusions about vaccine effectiveness to 6 months because that was the furthest time point that we actually had, not because that was the outer limits of protection. Simply put, to know if the vaccines will still be effective in 1 year, we will simply have to wait and see in 1 year. Nobody can guarantee a lack of side effects or a lack of rare negative reactions, but this is true for any drug or medical intervention. Even the most seemingly benign interventions have some risk associated with them. Throughout history, it's been a risk calculus that balances the risks of the vaccine and the risks of the disease the vaccine is meant to protect against that has justified mass vaccination. These previous pandemics saw widespread support for vaccination once it was made available. And this is because the side effects, even though serious, were far less risky than the risks of actually contracting smallpox or polio. The side effects for these other vaccines, however, we should remember were far greater than the risks of side effects that we are seeing for the COVID-19 vaccines. At the same time, we do have to remember that there are no guarantees in life. We balance risk and benefit even when we drive to the store. The risk calculus for these vaccines, however, seem fairly stark in favor of vaccination. It's true that many Americans remain distrustful of science and of media. It's incredibly important that we regain some of this trust in order to be able to have effective pandemic response. In this regard, it's incredibly important that we stop framing science in terms of ulterior motives and political agendas. For example, the US Surgeon General admitted that mask recommendations early on in the COVID pandemic were driven by concerns that masks be reserved for frontline healthcare workers. This undermines public trust because we must always ask for every recommendation, whether this recommendation is the best one for our safety, or if this recommendation is driven by some political agenda or other ulterior motive. It's been emphasized in the public health pandemic response literature for decades that effective response will require public trust, yet we seem to have ignored this recognized truth during COVID, and we are paying the price for ignoring what we already knew. There is probably no quick fix. It will likely take years or even decades to reestablish public trust, but we must apply what we know and start once again emphasizing transparency and honesty if we want to have the ability to effectively respond to pandemic threats.